Hello, my name is Tony Heil, Director of Communications and Public Policy with the ALS Association, Greater Philadelphia chapter. And today we're starting a new series of interviews and discussions with people who have expertise with caregiving or perspectives on ALS, especially during this COVID-19 coronavirus outbreak. I am pleased to be joined by my friend and colleague, Susan Walsh, who's been a nurse at our Hershey Medical Center Clinic for over 25 years, helping to start that clinic and helping to grow it to the nationally recognized center it is today. She's going to talk today about caregivers, tips during this crisis, this epidemic, to keep everyone safe, which I know will be important now, but also in the future for any other thing, because these aren't precautions that only happen now in this thing that's happening in the world. So, Sue, thank you so much for taking time to talk today. I know that you're very busy.
Hi, Tony. This is really a good opportunity for us to talk about some of the questions that are coming to us from our patients as we're still taking care of patients during this crisis. I got an interesting email from one of our patients last week, and he was curious about whether he should stop his caregivers from coming into his home. He was concerned about being exposed to COVID-19. And particularly, we know our patients are at risk, so he wanted to take every precaution. I really wanted to think this one through as a healthcare professional and looked to what we were doing in the hospitals for people coming in and out of the institutions, where other patients would be, how we were protecting patients, and what are just routine precautions that families should consider, both for caregivers that may be coming into their homes from agencies, or generally just as family caregivers providing care within the home itself. So these kinds of questions, if these patients are reaching out to us, I think are probably the kinds of thoughts and questions that every one of our family members are having. So my response to him was to really look at what general practices are and what kinds of standards and routine you should set up. I did not recommend, firstly, that the patient should stop his caregivers. We know how much the caregiving is required for our patients. We know that securing dependable caregivers is really, really difficult. And we know that keeping those relationships in place is going to be important, not just on the short term, but on the very long haul. We know that these nurses, aides, that caregivers, the CNAs are really, really dedicated, and they're under stress right now too. So we're not advising the patients to stop their caregiving, but to do a screening process and to set up standards for which the caregivers come into the home should participate. The first thing that we have also heard from patients is that many agencies are already have implemented really strong guidelines for their caregivers. And so the first thing that the family should ask is, what kind of precautions are the agencies taking with their caregivers, so that there's a clear understanding of what has already occurred through the agencies and what they're putting into place to assure our patients' safety. And then what kinds of things should the families do? I would say the first thing that they should do is they should screen everybody coming into their home, agencies, anybody at all, and do a temperature check. This will help to identify people who have an elevated temperature and may have a COVID-19 preliminary infection. So if a person has a temperature, that is a sign that they should probably not come in to provide care to the person. The next thing is that you should ask anybody coming into your home whether they have a known exposure to somebody with a COVID-19 infection. We know that over 50% of people may have had an exposure to somebody else, but they don't even know that they have an infection. But if somebody within their immediate acquaintance or exposure, if they've had exposure to someone, you should ask them not to come into your home because they have a potential for carrying a higher potential for carrying the infection. And that person should be quarantined for 14 days. So the first thing on somebody coming in is do a temperature screen if they have an elevation, or if they have been exposed to somebody with a COVID-19 infection within the last 14 days, they should not come into your home. And that goes for agency caregivers or any family or friends that may be coming in to provide your care. The next thing is that everybody should be doing the 20-second hand washing with the birthday song or whatever way that you can make sure that the hand washing is adequate. Soap is the #1 way to inactivate the COVID-19 virus, and good hand washing is important, particularly as caregivers come into the house, but also frequently in between any activities of care providing. And the next newest recommendation from the CDC is that everybody should be wearing masks. People in public should be wearing masks to prevent exposing people to unknown carriers. And if people are coming into your home, they should be wearing a mask. And that should be a new requirement that you have for people coming into your home. If they don't have a mask, I think it's an important project for you and your family members to put together. How can we design and implement a mask for our caregivers as they come into the house? And mask etiquette is important. I know as nurses, we're taught mask hygiene to make sure that we don't contaminate a mask, so that when somebody puts a mask on, they need to make sure that now everything in the front of the mask is now considered dirty. And you don't want the person touching the mask on the outside, and even they're leaving it on, and so that they need to use the mask as a reminder not to touch their face with and contaminate it. And they should not take the mask off while they're in the house, but they should keep the mask on for the entire time and remove the mask and put it in a dirty bag so that they know that that mask has been soiled, or they need to launder the mask if it's a cloth mask. So the biggest things are screening the personnel and family members to make sure that they don't have a temperature or that they've been recently exposed, making sure they're doing hand washing on coming into the house and doing it frequently, and now making sure they wear a mask when they come into your house, and that they remove the mask when they leave the house and keep that as a dirty or something that they don't want to use between clients.
And the other thing, as you mentioned before at the beginning of this, obviously our Howard I. Abrams in-home care program is still continuing. Our chapter is making sure that people are able to receive that care. So you said that people with ALS were concerned about whether they should turn down care, but those agencies are taking precautions, and that care is important. So don't assume, first of all, to say no to care. Your care and your health needs are very, very important.
Absolutely. We have been blessed with agencies that have continued to work with their aides to make sure that they know the safe precautions and that they are being as diligent about preventing and bringing infection into your home. So we're really, really grateful for all of the care providers, the CNAs that continue to work through this COVID crisis to assure that our patients are being well taken care of. So we really need to applaud them. They are really, really, really working hard, and we're very, very grateful for their care. The ALS in-home care program continues. Wendy Barnes is the coordinator for this. She's done an incredible job, and we want to make sure that even in the face of this crisis and this pandemic, that our patients are receiving care, whether they're through our clinics whether it's through our chapter professional staff or whether it's through any of our other programs like our loan programs or our in-home care programs.
And I've been really thinking about this since the start when you saw outbreaks in facilities. And you see now that in hospitals where unfortunately nurses and doctors are being affected at such a high rate over the other populations, our programs such as this are make it possible for people with ALS and their caregivers to remain isolated at this time. We talk about wanting people with ALS to be in the community, but these services allow you the ability and the freedom to keep away from the public when there's a pandemic such as this.
That's right. I will say, though, we've been so struck by our vendors, our respiratory therapy vendors who are coming in to continue to take care of our patients, our in-home nurses and physical therapists that we've continued to make requests for, because as our patients know, their needs don't stop just because of the COVID-19. But when any of these vendors or caregivers come into the home, these type of precautions and checks they're sort of like your tools to manage your care and take care of yourself as people continue to take care of you.
And for people who want to get in touch with Sue and wanted to get in touch with Wendy Barnes as well, please go to our website, alsphiladelphia.org. You can get the contact information for everyone from staff there. Please donate as well. If you want to donate directly to the Howard I. Abrams in-home care program, that is abramsalsphiladelphia.org, or just donate through the website. Makes it all possible. But one thing you did just mention, Sue, I want to reiterate, if people will have experts coming into their home, it's also maybe good when they come in, or as you do telehealth, you can give recommendations to make other parts of your house safer in addition to these tips that could be unique, either you telling them or that in-home caregiver telling them or nurse. These are things in your house that you should protect or keep closed or do this or that, because everyone's situation can be unique.
Right. Thanks, Tony. We appreciate the opportunity to connect with our patients. We want you to know that we're here. We're working hard every day. We're doing all the workarounds to continue addressing the needs that you have. So call us, know that we're here for you, and wash your hands.
Thank you very much. I've been washing my hands a lot. Thank you so much, Sue. I appreciate it. And again, visit our website to get in touch with anyone. It's alsphiladelphia.org, no matter what ALS treatment center you attend. Thank you so much, Sue, for your 25-year plus experience at the Hershey Medical Center for ALS Family.
Thanks, guys. Take care, patients.
Stop.